Welcome, Brett Johnson, New York City, OneMedRadio. Today I am with Dr. Eric Topol. He is the author of The Creative Destruction of Medicine, How the Digital Revolution Will Create Better Healthcare. Dr. Topol is the director of the Scripps Translational Science Institute and the co-founder of the vice chairman of the West Wireless Health Institute. He's regarded as one of the country's leaders and has been one of the most cited clinical research in the area of cardiology. He's a member of the National Academy of Science and has been named one of the 12 rock stars of science in GQ. Thanks for joining us today, Eric.
Oh, great to be with you, Brad.
So, Eric, can you quickly tell us, why did you write this book?
Well, that's an easy one. For me, it was that I had never done a book for the public, but I saw that the changes that were occurring, what can occur in medicine, were profound, and they only would occur in a reasonable time frame if I could get consumers educated and activated. And that was all about, getting a book out that hopefully would be having the right information, be readable, and help stimulate a conversation.
What do you think are the things that are the most important for people to know?
Well, I mean, there's a couple of things that probably are major themes that are not generally appreciated, but the first might be the fact that we've had this, remarkable asymmetry of information, with the medical community and doctors being the ones that held all the data and information, and now that's going to rapidly, move to the patient and consumer level, and that would be, housed on smartphone or from a genome sequence, or all sorts of ways that shift is very rapidly going to occur. And that, I think, is something that represents the biggest shift in the history of medicine alone, because, that likens back to the printing press days and, the whole Gutenberg transformation. So that is going to change a lot of what physicians do. Instead of being the holders of the data, they're helping to interpret and partner with patients, and that's a really big shift that obviously a lot of physicians are not ready to make, nor is the American Medical Association and many other parts of the medical community. So that's, I think, one big thing that is worth emphasizing, because I don't think a lot of people realize that this has already started. And there was a false sense that was going to happen in the 90s with the internet and access to medical information, but that turned out to be completely wrong, because while you can get information through the internet, it's not your information. Mm-hmm. And this is a whole different look when it's actually your data, whether it's your blood pressure or your genomic data, or you name it. It's your data, and now it's processed through all sorts of algorithms and graphically displayed, and all of a sudden now you've got insights you never had before, and I include none of us had before, because we didn't have a way to get a blood pressure reading every minute, even during sleep, or to do one's own sleep studies at home, and all sorts of things like that. Mm-hmm. The other big one, though, is a more in the future, like where does this take us to, and that's where that shift that people have talked about for years that needs to occur from sickness to wellness, or what I should say, chronic disease to prevention of disease. And I think we have the tools and the power to now make that shift. And I say that because the science is advancing so quickly, and we can bring together disciplines in biomedical research that never occurred before. Mm-hmm. So I'm particularly referring to, as one example, of embedded nanosensors. Mm-hmm. And you probably saw in the book about where this can go, but when you take a sensor that's the size of smaller than a grain of sand and put it in the bloodstream, and now you have virtually no added power requirement, because just the blood movement itself is enough to power a nanochip for years. So now you have a sensor that can see something that's circulating in the blood on a moment-to-moment basis, which whether that's a cancer cell, the first cancer cell, or whether that's a cell sloughing off from an artery that's ultimately going to lead to a heart attack, or whether that's an antibody that's directed against one's own tissue, like the pancreas islet cell for diabetes, or any other immune disease, like for example, a multiple sclerosis attack before it ever happens, or asthma, you name it. You've got embedded nanosensors and signals that we never were conceived as possible. A lot of people think, genomics is just a sequence, and are you going to have susceptibility to diseases defined? But no, I look at it as genomics is having your body under constant surveillance, because genomics gives us new markers that afford prevention, true prevention, for the first time. So you not only know who by genomics might need the sensor, the nanosensor, the embedded, but you also are using genomic signatures to direct the signal from the nanosensor to the cell phone.
Mm-hmm.
It says, you're like your car. It's basically turning the body, digitizing a human being like a car, where it says, lights up, your door is open or your transmission is shot, and here you've got the same warning lights on your phone about your body.
Mm-hmm. Now, is that going to be economically possible?
Oh, it's going to be economically not possible to use it, because preventing diseases, of course, is where it's all at.
Right.
So once you have a stroke, or once you've had a significant heart attack, or once you've developed, a metastatic cancer, the costs of those things are profound. So if you can prevent any of them, any of these chronic diseases, that is got to be like the greatest return on investment we could imagine.
Right. So you see sort of hope that the dilemma of unsustainable healthcare costs could be, in a sense, reversed or certainly diminished by the development of these new technologies.
Yeah, I think the ones I just were discussing, of course, are a little ways off, but even today you could remotely monitor people to keep them out of the hospital. That's going to become really big in the next year or two. You can prevent the need for a sleep study in the hospital, which costs $3,000 just by doing it in one's own home. The comfort of your home bed. For instead of $3,000, you can do it for $100.
Right.
So, and then you can use that same equipment for everybody in the neighborhood, if you like, or the family. So the whole idea is that this is innovating out of the mess that we're in the healthcare crisis. And one of the frequent questions is, well, you've got this great technology, it's very hyper innovative, whatever, but in the past, new technology in the biomedical space has led to increased costs, which is kind of what you were getting at. And the difference here is that could not even be conceived. And new technology now that increased costs is dead in the water.
Mm-hmm.
If it doesn't have a marked savings, pay for itself type look, it's not going to go anywhere.
Right. So the kinds of things you're describing are really changed the way the healthcare system works. And I think, as you talked about in your book, it's ossified, it's rigid, it's the least flexible, it has made little or no change. Can these new ideas overcome the status quo of people not wanting to change because it changes the economics of their entire existence?
Yeah, no, I really think that's the case. I think we're about to witness, especially if you take a broader temporal window, over some X number of years now, this enormous shakeup, like which we've never seen, and these new tools. Just as we saw how mobile devices changed our daily lives in the last decade, and it's been written recently, it didn't just change what we do, it changed who we are. Well, this is the next phase. This is the most precious part, our health. So I don't have any question of the power of the tools that we have at our disposal and how they're going to continue to really zoom ahead. That this is much more transformative than most people would even imagine.
Mm-hmm. And is there going to be pushback from the status quo?
Oh, there always is, and especially in the medical community. And the problem partly there is there's so many threats to reimbursement. When you don't have to go to an optometrist, but you can just get a $2 add-on to your phone and look in it and get refraction of your eyes and text to get your eyeglasses made. Or you can just take a picture of a skin lesion and don't have to go to the dermatologist, and on and on and on. There's a lot of pushback, a lot of threatened of the traditional reimbursement channels.
Right.
Which doesn't go over too well.
No, but which means the whole idea of consumerism in health is necessary for this to work.
Yeah, I mean that's actually the real reason why I did the book is I felt like we need to fire up the consumerism and the activism. I mean this is what it's all about. It won't happen soon enough without that force, and that force is a multiplier now from the social network standpoint, and the power of people is so augmented today relative to just a few years ago. So that's why I really believe we have this unprecedented ability to catalyze this.
So has anyone done a book or who else has been in this space of trying to sort of talk about the issues that you've been raising?
I haven't seen anything yet. I think the digital world is turning everything else upside down, but I haven't seen yet that a dedicated thing on this. I think the idea of the disruptive innovation of Clayton's was as close as it was to get to it, but it wasn't specifically all the digital tools that are going to achieve this. And including on the consumer side, the social networking, which is a critical part of all this. But that book of his was, I think, published 4 years ago, and I think things have changed a lot since then. And so I don't know of anything else yet that's been dedicated to how the digital revolution will fuel this. And it isn't just fueling the tools, but also the potential of this consumer-driven revolution. I mean that there's kind of this other level of it is, you got these new ways to capture data that we didn't have before, but it's also getting that to be the mainstay of care, prevention, daily routine practice of medicine, and that normally takes 17 years, and that we can't wait for.
So what
and hopefully it won't.
What can we do, or what advice do you give to citizens today, and how they can help make this new reality happen?
Yeah, so I think that's the key. What I try to do is to say, first of all, you need to seize control of your data because it's going to be a lot. There's going to be a flood of it coming, and you will be directing it. So, for example, now there are recent things like the JAMA paper, should patients have access to their laboratory data? And I'm saying, wait a minute now. How can you publish an article with that question in 2012? So the idea that each citizen owns their data, and so that's like step number one. And that includes genomic data, laboratory data, scan data, of course, office notes, across the board. Now, built on that framework and that tenet is the idea that there are new data to be had. And so if you have high blood pressure, you may want to get an ad app for your phone, like the iHealth or the Withings, to get a lot more readings that will, of course, will be graphically displayed on your phone, and then, of course, you can share that with your physician. but also, let's apply that across the board to other things, whether it's glucose or brain waves for sleep, or and on and on and on. That data you can get now. And so, do you know that? Do you want to get this? Are you ready for this? Are you ready to go beyond email and surfing the web on your phone?
Interesting. So what's the next step? Now you've done this book. Do you plan a follow-up, or is there any ongoing kind of work to get this message out?
Yeah, that's a great question. I mean, I need a recovery period since the book took more out of me than I ever imagined, and it was the hardest I ever worked on anything in my whole career. So I got to take a break from that. But I, for me, right now, the whole idea is to try to get as many interested parties like yourself to help, prod and get the conversation into higher gear. And so whether it's people like Reed Tuckson at United Health, who's a big advocate now, or and that representing the healthcare industry, or the informatics, the HIMSS organization, or mHealth and the CTIA wireless organizations, and companies that you might not have ever thought of that would be engaged, but maybe companies like Qualcomm or Apple or GE. So if we start getting this from multiple fronts, and I'm just kind of a cheerleader here, but if we get key leadership across large segments of the healthcare industry, and in particular, more than anything, consumers, then we can start to get this actualized.
Well, thanks for joining us today.
Yeah, no, I really enjoyed the discussion with you.
Okay, so that is Dr. Eric Topol, MD, who has written the book, The Creative Destruction of Medicine, How the Digital Revolution Will Create Better Healthcare. It's recently out now and is, I think, one of the best books that's been written on understanding the rapidly changing healthcare world. This is Brett Johnson, New York City, with OneMedRadio. Good day.